This is Dr. Kevin Jefferson. I am the chair of the Podiatric Medicine and Surgery section of the National Medical Association. We're here in Washington, D.C. at our annual colloquium where the theme is the quest for medical justice. I'm here with my main man, Dr. Gregg Williams from New Orleans, Louisiana. He serves as the co-chair of the scientific committee, helping to put our programming together. Greg, welcome back to D.C., brother.
Oh
Good to
man,
see you here,
same
man.
here, my brother. Good to be back.
All
Good
right.
to be back.
So we're going to be talking about what the section is doing as we move forward and lowering the amputation rate in this country, lowering the disparities of amputation when it relates to diabetes in communities of color, particularly in the Black community. We've known for a long time, it's not news to most of us, that the amputation rate in the Black community is much higher than other communities. And we're here to talk about what this section and the NMA is doing to curtail that, what we've done, especially last year in New Orleans, what we're doing now, what we're doing as we get ready for New York. Greg, why don't you go ahead and introduce yourself, bro?
Yes. Good evening. My name is Gregg Williams. I'm a practicing foot and ankle surgeon for 24 years. Finished from the New York College of Podiatric Medicine in 1997. Brother Kevin Jefferson finished in 1996. He actually was my big brother in school, and we both have been involved in the NMA, the NPMA, which was prior to which was our medical profession and organization before we combined with the NMA. And when I was a student, I was actually the local chapter president and vice president back in 95. And then in 96, I went on to a national position as the national secretary for the student organization. And during those years, we used to have an annual meeting where the students used to meet up with the podiatrists from around the country. And we used to have our annual meeting. And it's always been it always has been a goal of mine to be part of the change. And in order to be part of change in your profession, you have to be willing to put in that work. You have to be willing to put policies together to be part of drafting bills that can go to Congress to make the changes. And now our profession is part of the National Medical Association. We have had annual meetings over the years. Actually, the meeting 2 to 3 years ago in Atlanta was the thing that spearheaded the National Symposium on African American Limb Amputation. And we were both proud to be part of the first ever African American Limb Salvage Symposium in New Orleans in my backyard. And we had a very, very, very engaging symposium where we had a panel of 11 to 12 physicians from multidisciplinaries such as emergency room medicine, endocrinology, internal medicine, infectious disease. We also had some state legislators from the state of Georgia. We also had political leaders from Georgia Medical Society and the APMA, the American Podiatric Medical Association. And so now we are getting ready for our annual meeting in New York.
Yeah. So, like Greg was saying, Greg is a humble guy. So, what we were able to accomplish last summer in his backyard and his front yard in New Orleans at the annual convention, kicking off our our annual limb preservation symposium, which is a 4-hour program in the convention talking about this issue, was a brainchild of Greg. He brought it in. He saw a need. We were talking about this issue. We've been dealing with this issue for some time, but it was kind of piecemeal. A speaker here, a speaker there, throughout our 2 or 3 days of presentation. But Greg got the great idea of putting together a symposium, a block of time dedicated to this issue, coming from various disciplines in medicine, as he mentioned, and even more than that. And now it's all over the NMA, and now we got all these folks that want to be involved. In New York, we're setting aside a room for 150 people. So we had people standing room only in the back in our room last year. So now this year, this thing is really taking off. So come on out. Especially going to want to see a lot of you SNAPMA members from NYCPM and from Philly, and all you practitioners there in the New York tri-state area. Come on through. Come be a part of the learning. We all need to be a part of this process. You don't have to be a surgeon. You don't have to be out there putting X fixes on Charco feet to be a limb preservation expert. It starts with all of us. We all need to learn what we need to do in our individual practices, our clinics, our hospitals, wherever we may be in the community to help deal with this issue.
Yes, and Dr. Jefferson talked about some important things, and one of the things that kind of led to the symposium, to the African American Limb Salvage Symposium, is just being engaged as podiatrists with other disciplines in medicine. And we have grown not only as a profession, but we have grown as a section in the NMA. And so now we are here today at the colloquium where we have been able to be part of the quest for health justice. Under the leadership of Dr. Yolanda Lawson, the 124th president, she had three initiatives: women reproductive rights, health equity in the Black community, and DEI, diversity, equity, and inclusion. And those are very, very important things to bring to light, because guess what? Without health equity, without being able to make sure that we are part of the solution, the same thing that's going on as tearing our community as far as we're dealing with disparities, they will continue. But when we come to this meeting as the podiatry section, along with the other section, we all are engaging under one quest, and that's for health justice. We each have our own particular and unique issues within our professions. And our unique issue is limb salvage. Too many African Americans are losing their limbs at the highest rate that we've seen in this country.
And unnecessarily so.
Yes, and that's the issue. And there's many factors, such as lack of resources, uninsured or no insurance, race, demographics. All of these factors play a role in the amputation rate. And we, as the profession who is on the front line of dealing with wounds on the foot and ankle, of dealing with issues that affect the limb of the lower extremity, we have to be engaged as podiatric physicians and surgeons. We have to be the ones to be able to be on the forefront and to bring our other brothers and sisters from other disciplinary medicines and say that we cannot do this alone. We have to be able to work with you, not only in nursing homes, not only in referral systems, hospitals, clinics, FQHC clinics. We have to be all working together, because it's going to be a multidisciplinary approach that's going to be able to curtail this epidemic that we have going on. And furthermore, that this colloquium is allowing us to be able to get in front of our U.S. representatives. Just yesterday, I was able to meet with Troy Carter, which represents the state of Louisiana, 2nd District. And we had very engaging conversations about the fact of the things that's going on in Louisiana. But what affects Louisiana affects about 13, 14 states in that southern belt. And so, we all are connected geographically. So therefore, we are also connected medically. And so as you pass from one state, you go to another state. The only issue is that sometimes the laws are about the same. So even if you move to another state, you have the same problems. So it just doesn't affect one state. It affects an entire region. And if it affects an entire region, it affects an entire country.
And, Greg, you and I have been talking about this for some time, right? Not just this meeting, not just last year or 2 years ago in Atlanta.
Right.
But as podiatrists, particularly as podiatrists of color, and when we most often we serve in our communities, we need to get our own house straight first.
Right.
We need to better educate ourselves, train ourselves, and get modern tools and methods in our hands and in our offices.
Right.
We just can't get away anymore with just palpating pulses with our fingers.
Right.
We have to have non-invasive vascular testing where we are.
Right.
Not just write it on a piece of paper and try to send somebody out to the hospital to get it done. It's just going to take weeks.
Right, exactly. And so I would like to give honor and thanks to my co-sections, Dr. Kevin Jefferson, the chair, Dr. Adrian Sneed, Dr. Renee Settles. So they believed and trusted in me when they brought me along and asked to be the co-chair. And it all started back in maybe, I think, 2022, when we was in Atlanta at the annual meeting. And I was walking around the convention center, and I noticed there were so many topics on diabetes, but there was no reference of podiatry being involved in those conversations. And, I came back to the section, I said, how can we have a talk on podiatry, but don't have a talk on diabetes, but doesn't have a podiatrist involved? or at least bring up the profession of podiatry. So it was definitely my goal to say, look, you know what? If we can't be brought into the fold, we're gonna create our own. And we came back realizing that our next meeting was going to be in New Orleans, which is my backyard. And we put our minds together. We came up with the architect. We came up with the design to make sure that, you know what? The only way we're going to get this done is that we got to be more inclusive. We got to make sure that, you know what? If you don't want us a part of what you're trying to do, we're going to bring you into our arena. But guess what? We're going to be the leaders of that arena, because guess what? When it comes to the foot, when it comes to the lower extremity, podiatrists are at the forefront. And my message to a lot of podiatrists out there is that when you have these situations that arises in your office, you know, don't be too scared. Don't be alarmed to not refer to another podiatrist or to another specialist, because it's so important to make sure that that person, that patient, that the continuity of care is still there, and making sure that they are seeing a primary care doctor on a regular basis. And if they have to go see an endocrinologist, need be. If they have to go see a vascular surgeon, like Dr. Jefferson talked about, as far as getting those vascular testing, you actually can do vascular testing in your office. I have a machine called a Doppler, where I'm able to do pseudomotor, where I'm able to assess the nerves, and I'm also able to do the vascular. So I know beforehand I do any surgery on any patient, I know what their neurological status is, and I know what their circulatory status is. So if any of those numbers are abnormal, I get them to the proper specialist before I do anything invasive. So it has to be a multidisciplinary approach where we reach out to other doctors of other disciplines, but then also too, you have to be that engaging podiatrist that's going to be the front runner, that's going to be the one to say, well, you know what? If I can't treat this patient, I need to make sure that this person gets to the proper physician, and to make sure that continuity of care is there. Because the issue is that once these patients leave a podiatrist's office and maybe go to another arena who does not specialize in foot and ankle procedure, or specialize in the lower extremity, that's where the continuity of care gets lost, and that's where we see more of these increased amputations, and especially unnecessary amputations.
I mean, they're only going to do what they know, right?
Exactly.
General surgeons are trained to do BKs.
Yes.
Vascular surgeons are trained to do BKs.
Case, yes.
We are trained, or we're getting better at it. We're not
Right.
where we need to be,
Right.
but we have people coming in dire straits, and it's our duty, not just our
Right.
job, not just our profession, but our duty to save that limb.
Yes.
Because we know that if someone loses a leg due to diabetes, half of them are going to be dead in 5 years.
Yes.
50% 5-year
Right.
mortality rate.
Right.
It's higher than breast cancer. It's higher
Right.
than prostate cancer.
Exactly.
All right. So, you know, we got to take this issue off the back burner,
Right.
bring it up to the front, engage our legislators.
Right.
We got, William Long up in North Carolina doing
Yeah.
great work on the legislation side,
Right.
and the work he's doing with APMA.
Right.
William Harris
Right.
doing good stuff on that end.
Right. We got Lester Jackson
Yeah,
out
yeah.
in Georgia. We got Donzella James out in Georgia. And also, too, we have a U.S. Senator out of Georgia, Senator Warnock,
Right.
who's a big advocate and proponent of limb salvage. And so in this country, the way this country is set up, you know, everything is based on laws, legislation. So we definitely have to go to our U.S. representatives and our U.S. senators. And that's why we're in D.C. But it also starts locally. It starts at your particular state. And I was very, 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 very pleased and very humble to be able to be in the presence of Troy Carter, who is my U.S. representative from the state of Louisiana, 2nd District. And we had a very engaging conversation with his staff about these particular policies to be put in place, about getting a bill drafted. So in order for us to get this moving in the right direction, sometimes it takes physicians not to be physicians. We're not saying you have to be a politician, but you know, it's something as simple as a phone call to your legislator, as something as simple as writing a letter, and then also attending meetings like this. This is where you can put a name with a face. This is where you can make the contacts. You can do the networking. So that when the meeting is over, you go back home, and now you can start that ball rolling at your prospective state.
Greg, you and I have been doing this work for a long time.
Yes.
Even long before we joined the NMA.
Right.
Right. And not to toot our own horn, but we're no different than any other podiatrist out there.
Right. Right.
Right.
Yeah.
And no, you don't have to have gone to, you know, the A-list, top tier, top shelf podiatric residency
Right.
to do this work,
Right. Right.
right?
Exactly.
I learned this stuff. Most of the stuff I'm doing now in my limb salvage, limb preservation part of my practice, I learned 10 years after I started practicing.
Right.
Right? I went and I learned. I went to this lecture. I went to this, training session.
Right.
I went down to where they make the materials,
Right. Exactly.
where they make the biosynthetic grafts,
Right.
where they make the wound vaccine. I learned
Right.
how to use this stuff.
Right.
And I
Exactly.
implement it in my practice.
Right.
And so now we're in a position, being part of the NMA,
Right.
that we're able to bring all of those resources to us at our meeting,
Right. Right.
right?
Exactly.
So folks can get their hands on this stuff and learn how they can implement it and put it in their practice so they can put it in their communities. Part of the problem with the limb salvage or with the amputation epidemic, because it
Right.
is that there's too many doctors, too many podiatrists who don't have these resources in their office. They don't have the
Exactly.
training.
Right.
Right?
Right.
They don't have the biosynthetic grafts. They
Exactly.
don't know how to put on a wound vac.
Right.
Right? And
Exactly.
again, you don't have to have gone to the best podiatric residency in America to learn how to do this stuff.
Exactly.
All right? Start doing your research or start doing your homework.
Right.
Start learning how to do this. Talk to people like myself, like Greg, around your community, and learn how to do this stuff.
Right.
Because the need is there. Our people are crying out. When somebody loses a limb, they lose the ability to support themselves, their family, their children, uh, and their communities.
Right.
And like I said, it's at epidemic levels now.
Right.
COVID tore the scab off a lot of
Oh,
things
yes.
in the health system in this
Right.
country.
Right. Right.
And limb amputation is at the top.
Right. Exactly.
Mm.
And you brought up a good point, Kevin. COVID exposed a lot. It not only broke down the fabric of our DNA of our medical system, but when you talk about educational, you talk about the judicial system, everything was shut down. So when everything that is like the blood vessel to the heart, when you cut into a blood vessel, you cutting that blood supply, you cutting the life, you cutting the source. So everything just dies, and you got to come back, and you got to come back to the. You got to reconstruct. You got to find a way to regenerate that and bring things to life. So Kevin brought up some good points about as podiatrists. You know, you're right. You know, I was fortunate enough to be trained at Staten Island Hospital, 4 years of foot and ankle training. And the great thing about that training, which we pretty much right now the way the present thing is as far as dealing with wound care, I was trained at a facility. My hospital had a facility known as the Diabetic Foot Center, and a Diabetic Foot and Ankle Center was a center that had multidisciplinary approaches. And so we work with internal medicine doctors, we work with plastic, we work with vascular, we work with an endocrinologist, we work with orthopedics. So every rotation, you'll be able to spend some time with that particular specialty and learn those different techniques and those different procedures. And so unfortunately right now, the way we set up, we have lost diabetic wound care centers, and now we have wound care centers. They are no longer diabetic foot and ankle centers, they are wound care centers. And unfortunately, a lot of these wound care centers may not have a podiatrist, may not have a foot and ankle specialist working there. So, but does that still mean that you do not know how to do these procedures? If you come to the NMA conference and come to the podiatry section, you know, we have had workshops. We have had how to put on a wound vac. I did a lecture on biologics. We do a lecture on limb salvage. We also have workshops where you can learn how to put on skin graft, how to do flaps, how to put on a wound vac. And then also too, when you come to the NMA conference and be engaged in the podiatry section, you are able to network with podiatrists from all around the country. You get their phone numbers, you get their emails. And if there's ever a question or something you are not, that you're concerned about, or something that you may not be familiar with, pick up the phone call, get on your laptop, email someone, and ask them that question. And believe me, NMA is going to make sure that you get that answer to your question. So there's never no need to say, well, you know what, I don't know how to do this.
Get educated. Let's turn this thing around. I can't do it by myself. Greg can't do it by myself. It's a countrywide problem. It's just not a DC problem. It's just not a New Orleans problem. It's coast to coast. Let's get in. Come to New York. Get connected. If you can't come to New York, I can dig it. Reach out to us. All right. Our membership. You can click on it and find out where people are, so you can ask the right questions. All right. So we'll see you there. Peace.
Peace.